Welcome back. Now, at least 25% of couples in the productive age in Africa are infertile, with the majority of the cases going untreated due to late diagnosis. Now, an alarming statistic that is often not talked about due to the stigma attached to the matter. We'll be discussing the kinds of infertility, the causes and treatments with my guests in a moment. But first, let's put a face to that statistic. The story of Cecilia Karanja is one many women in Kenya can relate to, but would much rather want to keep concealed. Unable to conceive and castigated for it, Cecilia bore the brunt of criticism from a society that is less than forgiving of women that are unable to bring life into the world. Watch.
I stayed for 11 years without conceiving. I've been married twice and divorced twice, so I'm in my third marriage. And in my first marriage, I was told that I was okay. Everything was fine. They did the laparoscopy. They did the HSG, they did the pelvic scan, they did the hormonal analysis, and they found that everything was okay with me. Yeah. So what was the problem was the partner then. He had low sperm count. But on the second, that is when I was diagnosed with blockage of tube and fibroids. So doctor advised that we have to remove the fibroids through laparoscopy and also try and open the tubes. So the in-laws, it was not a very interesting thing because like I've always said in my first marriage, they say that I got married because we wanted dowry. Like you all know, I'm an orphan, so they thought I'm getting dowry from them, that I will never, and I knew that I will never conceive. So these are most of the challenges that I used to get, and then when we go to church, there's that thing of being told that I've been bewitched. So they will pray over me and put hands on me and try and remove the curse out of me. And to a point I thought, yes, I think I'm cursed and I'll never get a baby.
All right, a very heartbreaking story there when you see Cecilia Karanja, recount that very hard moment in your life. Thankfully, that is not the case now. But before we get into what happened after, just walk us through that experience, 11 years of not being able to have children.
It was not interesting, Victoria, because I was not able to face people. I would not be able to go to baby showers. I could not be able to, I used to feel like less of a woman. And I bore the stigma because everyone would think like, most of them thought that I aborted. Yeah, so they will think like I'm a bad girl, But I thank God that, I came out of it.
Right. Fortunes have indeed changed. The reason why you are the founder of Fertility Kenya, we'll get to that. But let me introduce my other guest, Dr. Omanwa Kireki, and you are an IVF specialist. You've walked women, couples through this because it's not just women who struggle with this. That's often, the perception that's out there when it comes to infertility. But what are some of the common cases of infertility that you've seen here in Kenya?
First of all, Victoria, thank you very much for inviting us to the studio today to talk about this topic, which is a very sensitive, a very private, very stigmatized topic that people don't want to talk about. So the more we talk about it, the more we hear stories like Cecilia's, I think more couples are going to be encouraged to come out and seek for help. When we talk about infertility, maybe I would start right from the beginning. Yeah. The World Health Organization has divided infertility into two categories. The first one is what we call primary infertility, where a couple who are living together with an intention of procreation, having regular intercourse 2 to 3 times a week, they're not using any contraception, and a year has passed and there is no conception, there is no baby. So we call that primary infertility. Now in secondary infertility, is a situation whereby a couple, again, living together with an idea or with the plans of having conception, have had a pregnancy in the past, or they have a baby or babies for that matter, right, and they're trying to have another one. And in the same time range, 1 year has passed, regular intercourse, no contraception, that is called secondary infertility. Okay. When we look about, when you talk about infertility in sub-Saharan Africa, talk about the developed world first. Generally, it affects about 8 to 9% of the population in the developed world, in the US, in North America, Europe, and so on. When it comes to sub-Saharan Africa, we have the highest, unfortunately, incidence of infertility. It is an approximate, a conservative estimate that about 30% of the population in sub-Saharan Africa actually have issues with infertility, which is a paradox.
Yeah, exactly. Yeah. Why is that?
Number one, because it is a paradox, because we have the highest reproduction rates, and then we have the highest infertility rates as well. When we come closer home to Kenya, again, a conservative estimate is about 15 to 20%. If we put it in numbers now so that we can have a proper perspective and context about what we are talking about, if we estimate that the Kenyan population is about 45 million, so if we take 10% of that, that will be 4.5 million, and we add another 5% to that, that will be another 2.5 million. So put it together, is over 6 million Kenyans are affected with infertility. So imagine Nairobi has a population of slightly over 4 million. So you'd say everybody who is in Nairobi, plus a few more, are actually have issues with infertility. A huge number.
And have they kind of come up with reasons as to why that's the case? What could be causing this?
Yes, actually we do know what some of the causes of infertility are. If we look again in terms of percentages, about 30% of infertility cases is because of the ladies. About slightly over 30%, about 30 to 40% is because of the men. The rest, about 20%, is where both the man and the lady are affected. And a small percentage is where we really don't have a reason why. Now, when we come to the ladies, in this part of the world, the biggest problem that I see in my daily practice is blocked tubes. I see a lot of patients who come and they have blocked tubes, and the main reason for the blocked tubes is basically infection. Sexually transmitted diseases, for example, gonorrhea, syphilis, chlamydia, which is a silent disease, has no symptoms at all, and the patients can have an infection and they don't know about it. Now, if we go a little bit further, age is becoming a factor, which I think we should highlight. When we get to about 35, and afterwards, the fertility rate starts dropping. I think this is something which the Kenyan population needs to be aware. The ladies need to be aware about this, simply because ladies are born with a set number of eggs, unlike men who actually keep on producing sperm every so often, every 3 months or so. Ladies, their numbers decrease with every month. So age is a big factor. We have issues with fibroids. Statistics say that about 40 to 60% of ladies of African origin, it doesn't matter where you come from, whether you are Kenyan, whether you are Nigerian, or whatever it is, or even out there in the diaspora, you have a 40 to 60% chance that you will have fibroids in your reproductive period.
And let's get that from Cecilia, because that was your case, the blocked fallopian tubes and, of course, fibroids. You did end up going for surgery. But how did you find out that that was the problem in the first place?
I think in the first place, I did the test, and we found out that I did not have a problem. And later on, I went to when I went into the second marriage, I found that I could not conceive. So I decided to go back and check what was happening. That is when they said that I had blockage of tube and I had fibroids. So they did a test and later on did a laparoscopy where they operated on me and removed the fibroids and also unblocked the tubes.
What was that process like for you? Because it's almost like a breakthrough. You finally found the problem.
Yes.
Because in the first marriage, You were not the problem.
Yes, I was not.
Second time around, you find, okay, but we're able to fix it. How did you feel? Did you feel like finally this is my moment to be a mom?
I think I didn't. I felt so offended because I thought like Daktari was lying to me, because I had to go back to Daktari and ask him, you are the same person who told me that I was okay. Now you're telling me that I have a problem. So what is this? Because I couldn't understand. But Daktari explained and told me that it normally comes with time. You could be okay today. And I always tell people, you could be okay today. You could have a child today, but tomorrow you're not able to get a child. So fertility changes with time. So after Daktari realized that I had a blockage of tube and I had the fibroids, told me the only solution is to do laparoscopy. So at least there was a solution. Yeah. That really was the key, that there is a solution. Because if you told me that there wasn't a solution, then I will be, I don't know, I think I'll be devastated by now.
Before we get to that glimmer of hope, you know, you talk about your story now with such ease. I don't know a woman who has gone through 2 divorces as a result of infertility and still able to sit with your head held high and share. Where does that strength come from and confidence come from?
I think the strength comes from the promise I made to God. I made a vow to God that if you give me this child, I will use that child to praise your name, or I will use that child to reach out to other people. So for me, I talk about my story because I made a vow to God. And number 2 is because when I was struggling with infertility, I could not talk to people, or I could not, I was not able to talk about what I was going through. So it's, I'm creating an atmosphere to these women who are not able to talk about their story, to just come and talk to me, to just start with me, or just start with a friend, or just start with somebody, so that at least from there, if you're able to share your story, or if you're able to tell somebody what you're going through, or you're able to relate with somebody who went through the same and succeeded, then it will be easy for you. So for me, it's more of I share my story more because I want to encourage that woman who is out there, who is just devastated, who doesn't know what to do, who doesn't even have hope that they will ever get a child. So yeah, and I really love it when these women come to me, and my greatest achievement for me is when a woman come to me and they tell me, Cecilia, I've stayed for 20 years and I've never gotten a child, and then I walk them through and then they hold the bundle of joy. That is the most greatest achievement, and they always do that. We just cry together. We cry together because I know the pain they are going through. Yeah. When they come to me, I relate to the point, because like today I had somebody who came to me and she told me that I've been diagnosed with a small uterus. I can't carry this child. I don't know what to do. But I gave her hope. I told her, no, you can be given medication and we try and grow the uterus and you can carry that child. Right. Or even if you're not able to carry that child, you can be, somebody else can carry for you through surrogacy. Right. And that when she was telling me this, she was crying. But when she left there, she just hugged me, and she got this hope back that at least I'll get my own child.
And Daktari, let's talk through that, the solutions that are out there, you know, for individuals when it comes to the various cases of infertility.
First of all, let me applaud Cecilia for what she's doing, that she can actually come out and say, you know what, I had this problem, I've gone through 2 marriages, now I'm in the 3rd marriage, but I got a solution. We have, infertility is a condition which is stigmatized. Stigmatized, number 1, because you can't have babies, and stigmatized, number 2, that your babies are through other means and not natural. So some of the questions, actually 2 weeks ago, on the 25th of July, was the 40th anniversary of the first IVF baby, Louise Brown. When she was born, the newspapers came out and said, now doctors are going to engineer babies, they are going to be Franken babies, and so on and so forth. But that achievement in itself, which is a mere 40 years, which is a small blip in the history of medicine, has actually given us a lot of hope. It has given millions of couples out there who before that would never have actually even dreamt of having a baby. Right. So presently over 6 million children have been born through assisted reproduction techniques. Okay. So there are solutions. Now the solutions would depend, number one, on what the problem is. If we have a problem, for example, with blocked tubes, like in her case, sometimes doing a laparoscopy will help, but sometimes it doesn't help, because if they are blocked and we try to unblock them by cutting or by doing what is called a tuboplasty, then the tubes will block back again later on when the healing process starts. So in such a case, we would think about doing IVF. Okay. In gentlemen, for example, actually, I am happy that ladies can come and you can talk, you can cry together, you can hug each other, and you can share your problems, and you feel better afterwards. It's sort of a therapy, actually. Gentlemen, we can't do that. No men don't do that. Men will talk about football, we talk about politics, we'll talk about finances, and so on and so forth. But something which is so critical and so personal, we never come out with it. But even with men who have issues, let's say, for example, a low sperm count, or sometimes they don't have any sperm at all, there are possibilities as well where we can use medications to treat any issues which are there with the sperm count, for instance. If there is no sperm at all, as I have seen recently, I'm seeing quite a number of men who are coming with no sperm at all, or the count is also extremely low. But when you take the medical history, you find everything is okay. They are young men, relatively young men, they don't smoke, they don't drink, and they are active. So we are trying to find out what some of these problems are. So there are solutions. Apart from IVF, which is the hierarchy, the top rung of in the hierarchy of treatment. Number one, we start by simple solutions. Let's find out what the problem is. Let's use these medications. Let us try one method. If it doesn't work, and we have to put the whole problem in context. How long have they been trying to have a baby? So all these things have to come into a broader picture before we decide. We tell you, okay, this is the treatment that we can offer you.
Cecilia, I wanted to know, did you actually go for IVF?
No, for me I didn't go for IVF, but I did laparoscopy. I normally get my kids naturally.
So you have 3 kids. I guess it's time to let the cat out of the bag. You have 3 children. We were actually with you at your home on Friday, and I can only imagine how amazing it is to hear those little voices saying "mommy, mommy," and they're jumping on your lap and tugging at you. It's a sense of victory and vindication, I'm sure, for you.
Yeah, very. I think my greatest achievement, I personally, is just having those little babies. That is the only thing I can call my own. I normally tell women, you can build mansions, you can do anything, but you cannot call your own. Anything can happen. Yeah. But if you have that one child, at times they come to me and they tell me that, Cecilia, IVF is very expensive. Right now I'm paying school fees for my brothers. I'm doing what. No, they will never call you mommy. Just save that money, do IVF, or just do the correction, or just try and get that child. Because once you get that child, that will be the greatest achievement.
Speaking of which, because a lot of people say it's too expensive, like you're saying, what is the price range of IVF, at least in Kenya? In Kenya.
Thankfully, I just want to let people to know that actually whatever processes, whatever ART technologies, assisted reproduction technologies, which are out there in North America, in Europe, wherever it is, South Africa, even in India, we actually have them here locally. So people don't have to travel outside there to go and have this treatment done. When it comes to the prices we have, they are relatively expensive because the range of doing an IVF cycle, and a cycle means that we start treatment right from the beginning until we get the eggs, we fertilize the eggs, and we have the embryos, and we transfer the embryos back into the lady's womb. It costs anywhere between 400 to 500,000, which is a huge amount.
With no guaranteed success, might we add?
Exactly. It is not 100% guaranteed.
100%.
So, and the success rates also vary. In Kenya, it's about 40-something%, which is actually a very decent success rate.
And I wonder what happens to couples who can't afford, and that's the option.
I think that's where we appreciate our government because of NHIF. I want to give out the good news that NHIF is covering IVF procedure for the civil servants. So any civil servants who is out there and you need to do the procedure, you need to just come and just get the procedure done. Everything covered full.
And I'm just thinking in terms of the couples who can afford, they go through the process. There's now the stigma of what they call test tube babies, what you were talking about, right?
Thank you.
How do we deal with that? Because you're castigated for not having children. You can now have the children, and you're exactly. So how do we deal with that?
Now, I think that is we are in a process of I don't like using that word evolution, but we're in a process of developing because it is exactly the same situation in the UK when the first IVF baby was born. There were protests. People were sending hate mail to these first IVF parents. But with the time, it has been accepted as a normal process. They have looked at the children. You look at the pictures, they're just absolutely normal children. So I think the more we talk about it, the more we see cases like Cecilia's coming out, the more we have patients who have gone through it coming out and saying, you know what, it was a problem, but now I'm Mama so or Baba so and so. So it is a natural process. Guys, don't worry. These children are perfectly normal. So I think advocacy and what you're doing now by inviting us here to the studio, I think is one of the biggest steps that we have to talk about this problem. We have to open it, destigmatize it, and know that yes, it can be a problem, and it is a problem, but there are solutions to it as well.
All right, on that note, let's take a short break. When we get back, we'll be hearing about more of the work that Cecilia is doing with Fertility Kenya, and of course, your feedback on this matter.